Which of the following is true about DDH? Male gender risk factor no, female is the risk factor. Limbs are in adduction, internal rotation and flexion in older children, yes. Femur neck is retroverted, false. Ligamentum teres is atrophied, false. So the true is limbs are in adduction, internal rotation and flexion in old child. Following is not a part of ortolani test. In ortolani test, we perform reduction by doing abduction. So not a part of the jerk is given to the knee to dislocate the femur. No, we do not dislocate, we do perform the reduction. We do the reduction of the dislocated femur head. A female with history of oligohydramnios during her pregnancy brings her newborn baby to OPD on noticing asymmetric thigh folds in her child. The examiner performs flexion, interrotation and abduction, which produces a click sound, which test is done by the examiner. As the examiner is performing abduction, and abduction is done for reduction in the ortolani test. All of the following are true regarding congenital dislocation of the hip except asymmetrical thigh folds may be seen, yes. Gallagher sign ortolani test may be positive, yes. It may be bilateral, yes. Polyhydramnios is non-factors, no. Or oligohydramnios is a non-risk factor. The following pelvic X-ray was seen in a patient. All the following signs will be present except this X-ray is of developmental dysplasia of the hip, as the head is in the upper outer quadrant and sentence line is also broken. So ortolani test is for DDH, Barlow test is for DDH, and Jensen test is not for DDH. A 4-month child diagnosed with DDH cast used for closed reduction is hip spica, as pelvic hardness is used for maintenance of the reduction and it is not used for the reduction. Pelvic hardness is used to treat DDH. Irregular thigh folds are seen in DDH. Which of the following is not seen in a child with DDH? Waddling gait is seen. Feeling of femoral artery pulsation is difficult, yes, it is difficult. Ortolani test is positive, yes. Decreased growth hormone, DDH is not related to hormone, so it is false. Ortolani test is used to diagnose DDH. Positive Gallagher sign is seen in unilateral DDH. Because in Gallagher sign there is shortening of the when the patient is made slept on the couch, the affected limb appears shorter in Gallagher sign. But in bilateral DDH, the both will move proximally, so it will not be shorter. Perkins line on X-ray is used for diagnosis of DDH. Ortolani test is positive when the examiner hears the clunk of as in ortolani test abduction is done. The clunk of entry and abduction and flexion of hip. Clunk of entry, not exit. Click of exit, no. Entry, because ortolani test is done for reduction, so entry on it is abduction is done and flexion of the hip. This is the following is not a feature of DDH. Smaller epiphyses of femoral head, yes. Inclination of acetabular roof is increased, maybe. Sentence line disrupted, true. Femoral head is anteverted, it is false. Salter's pelvic osteotomy is done for treatment of DDH. Is the acetabular reconstruction procedure. Von Rosen sign is positive in DDH. Bachelor's cast is used in DDH. Provocative test for detecting CDH is Barlow test. The Barlow test is a provocative test, and ortolani test is for reduction. Dysplastic hip in child investigation choice is MRI. Primary pathology in CDH is shallow acetabulum. Alpha angle is decreased in DDH. True about bilateral DDH. In bilateral DDH, there is exaggerated lordosis, bilateral genu-valgum, waddling gait, sentence line broken, short stature. All of the following is true, yes. All of the following statements are true about developmental dysplasia of the hip except it is more common in females, yes. Oligohydramnios is associated with high risk of DDH, true. The hourglass appearance of the capsule may prevent a successful closed reduction. It is also true, because after 6 to 18 months, closed reduction is difficult because the internal capsule of the hip assumes a hourglass appearance. Twin pregnancy is not a risk factor for DDH. Barlow test is done for testing DDH in infancy. In a newborn child, abduction and internal rotation produces a click sound. Abduction is done for reduction in ortolani test. Commonest deformity in congenital we can also remember as DAD, as in for the dislocation we do adduction. Dislocation we do adduction in Barlow test. And RAB, for the reduction we do abduction. Commonest deformity in congenital dislocation of the hip is salloacetabulum.